Good morning, and thank you for being here for this very important COVID update. Today, I'm joined by Public Health and Environment Executive Director Bob McDonald, City Attorney Kristen Bronson, and Dr. Connie Price, Chief Medical Officer for Denver Health. A week ago, in my State of the City address, presenting our vision for the future, I talked about the hard-earned economic recovery that is already underway and cautioned that the pandemic had not fully released its grip on our city, our state, our country, or our world. A resilient city, and we are resilient. But we must protect its people and the progress we have made together. No one wants to relive the horrors of last year. No one wants to see another stay-at-home order to stop a crisis that threatens to overwhelm our hospitals. With the highly contagious Delta variant surging across much of the nation, even our 70% vaccination rate among those eligible is not enough to fully protect our residents, families, and businesses, or the economy from another devastating blow this fall and winter. That's because not every community in our country is taking the scientific miracle of these vaccinations seriously. In the past 6 months, 96% of the people hospitalized with COVID-19 in Colorado were not fully vaccinated. 90% of those new cases were caused by the Delta variant. While masking and social distancing are important tools to protect those who have not been vaccinated and may even be useful for particularly vulnerable people who've been vaccinated, the truth of the matter is that these measures are no substitute for what we need to shut the virus down for good: more people vaccinated. That's why, after considerable deliberation and consultation with public health experts, including my Chief Public Health Officer, Executive Director Bob McDonald, I am approving a far-reaching public health order mandating that all city employees, as well as private sector workers in high-risk settings, be required to be fully vaccinated against COVID-19 by September 30. This new public health order applies to the City and County of Denver's municipal workforce of more than 10,000 employees. The requirement also applies to workers in congregate care settings like nursing homes, shelters for the people experiencing homelessness, hospitals, and correctional facilities. Vaccines are also required for teachers and staff in schools and post-secondary institutions. We are also extending this order to include certain categories of city volunteers and contractors. Now, let me be clear. This order is not intended to punish or denigrate any employee who has been reluctant to take the vaccine. I know that many of us have family members and friends, neighbors, and colleagues who have concerns about the vaccine despite assurances from top medical professionals across the country and around the world that it is the safest and most effective way to protect against this deadly virus. We intend to use the next 2 months to engage our employees and affected workers, answer their concerns, and provide them with objective and science-based evidence supporting more widespread use of the vaccine. We're more than aware that much of the COVID-19 response has been politicized, and significant misinformation about the vaccine and other public health precautions is floating around social media and irresponsible media outlets. We will work to address these concerns, and we will also protect those with religious and medical reasons that support narrow exemptions from this order. It's important for everyone else to know that the COVID vaccine is safe, widely available, and free of charge. Now, to be clear, this requirement does not change city regulations regarding face coverings, but our strategy to protect our employees and our residents and the public we serve will not be to rely on face coverings, testings, and social distancing alone. The silver bullet we need for full recovery is to ensure maximum vaccination. We are committed to keeping businesses and the economy open while ensuring that employers and employees feel safe in the workplace. Now, we are encouraged that this is the right course because of the growing number of private sector employers are also requiring vaccinations as a condition of employment. That is a rational and science-based approach to defeating COVID. And I believe that the people of Denver will expect their city government to do the same. Now I'm going to bring up Bob McDonald. He is the Executive Director of the Department of Public Health and Environment. Bob will come with more information on the vaccine mandate. Bob?
Thank you, Mayor. Over the last year and a half, when I've given updates, I've focused a fair amount on where we've been and where we currently are. I want to spend less time doing that. I want to talk more about what needs to happen, where we need to go. Let's take a look at the next slide. You can see just over the last few weeks, we hit a low of 15.4 cases per 100,000 in Denver. And now it's more than tripled. And it continues to climb at a rapid pace, faster than what we saw this time last year. So I want you to understand that after all of our efforts, we are seeing a spike when we generally would get a little bit of a seasonal break. We are seeing a spike faster now this year than we did last year at this time after all of our efforts. Next slide, please. Coupled with that concern is the fact that vaccinations have largely stalled. We've done very well in Denver with a vaccination rate above 70%. But with this more infectious variant, 70% is not going to get us where we need to be. You can see that spike that I talked about. Imagine that spike going into the fall. You remember what we all went through November, December, January, and February? That was without this variant. So we got to get ahead of this. We have to have more people vaccinated before the fall hits. Next slide, please. Deaths have steadily gone up. They've plateaued a little bit here. And so I've gotten this question a fair amount. You know, mortality is not going up. Why would we do this now? Mortality is not going up. I guess my question would be, would the preference be that I wait until mortality goes up? We need to make sure we're ahead of this so that we don't see another spike in deaths going into the fall. Next slide, please. We do not have a face covering order. You know, the logical question is why not? Why not have face covering orders and testing and do all the things that we've done? You know, if there were no downside to public health orders, this position and these decisions that the mayor makes that I recommend would be very easy. Let's have all kinds of public health orders. Let's have vaccinated people mask, but that's not going to get us where we need to be. I would suggest for those that are unvaccinated, get vaccinated. You need to get vaccinated. But if you're not vaccinated and you're thinking about going out in public, particularly if you're immune compromised, wear your mask until you get vaccinated and give some strong consideration about whether or not you even go to large gatherings, particularly in indoor settings. Next slide, please. So we will roll out a lot of information about who this applies to. They're very, at a high level, 3 categories, if you will. City employees, high-risk venues, and high-risk occupations. You might ask, what's the difference between a high-risk venue and a high-risk occupation? A primary care physician might be in a high-risk occupation, but the receptionist at the front counter is in a high-risk setting. So in order to get everyone in high-risk settings and high-risk occupations, it includes everyone. This is already being done. This is being done in the healthcare system. We need to get it done in long-term care facilities, the jail system, everywhere where we have seen cases spike and the majority of the cases occur. Next slide, please. So why now? We have been for a year and a half now. We've ordered face coverings to be worn. We've had a series of testing regimens. We've tried a stay-at-home order, and we've tried capacity limits. We've tried all of those things, and a year and a half later, after all of that, here we are. We have a virus that's mutated to the point where those things are becoming decreasingly effective after a year and a half. So that should answer why don't we continue with the same public health orders? Because if we do, we're going to get what we're getting now. It has not worked. The only thing that's going to get out of us is mandatory vaccinations. We are not going to mask our way out of this. We are not going to test our way out of this. We need to get people vaccinated. That is the only way that we're all going to pull out of this. So whether you are involved in this order, whether this order applies to you or not, I'm asking everybody, please get vaccinated. We're going to go into the fall. We're going to see the same thing we saw last fall, particularly with this infectious variant. We need to act now. Get vaccinated. Next slide, please. Here's information about where you can go to get that done. Number of sources here to reach out with your questions. And with that, I'll turn it over to Dr. Connie Price with Denver Health and Hospital Authority.
Thank you, Bob. Thank you, Mayor. I applaud the city's decision to mandate vaccines to further stop the spread of COVID-19 in our community. Vaccines work. They decrease the risk of infection and almost eliminate the risk of severe illness and hospitalization, and they're necessary to protect ourselves and others. Mandating a vaccine is not unusual in high-risk settings like the hospital to protect patients and our most vulnerable patients and staff. Denver Health is proud to be part of a growing number of healthcare institutions across the country who support this requirement in order to protect our patients and staff from severe infections from COVID-19. It has been shown, after millions of doses administered around the world, to be among the most safe and effective vaccines available to prevent infectious diseases. Scientific societies and professional organizations have supported such mandates in healthcare and other high-risk settings. This mandate is necessary, especially as we enter into the fall and winter months, to help control the spread of this virus and emergence of further variants, and ultimately limit the loss of lives. Thank you.
Thank you, Bob and Dr. Connie Price. Again, I want to just share that as we get ready to go to quick Q&A, that along with us today is the City Attorney, Kristen Bronson, who will be here to address any legal questions that may come from you all. Let me just say this as we get ready to go to Q&A. You know, none of us up here take these decisions lightly. This has been a pretty heavy deliberation about this very important subject matter and this decision that had to be made. At the end of the day, this is about making the workplaces safe, but also protecting residents who may have to interact with our with employees in very at high risk locations. Not being an easy decision to make, we do believe with confidence this is the right decision to make. A lot of work, a lot of effort, I'm talking about by all Denverites, have already gone into bringing the city where we are today with regards to our vaccination numbers, but we are severely threatened by people who are not vaccinated today, who are unvaccinated, if they contract the very transmissible variant, Delta variant that's out there, and the need for more and more attention from our hospitals and our medical system, as well as a danger to those who are around them and, of course, to themselves. So with that, why don't we go ahead and open up, Gabby, for question and answer.
All righty. We're going to go in order. We want to start with Dave from Denverite. Do you have a question?
Hey, Gabby. Yeah, my question is about how this will be enforced. Will there be some sort of way for the city to check if people have been vaccinated, or do they just have to sign something? And then obviously the same question for the private sector, which seems a lot more unwieldy.
Okay. Kristen, why don't you come up and answer the first one?
Hi, I'm City Attorney Kristen Bronson. We are asking that employers be responsible for compliance within their own operations. And so we will expect employers to make sure that their employees are complying and maintaining records to demonstrate compliance. Obviously, if we get a complaint and we approach an employer about whether or not they're in violation of the order, we want to work with that employer. And our goal is compliance. We obviously have an ordinance that allows us to impose penalties for noncompliance, but our first approach to enforcement will be to work with the employer to gain compliance.
Alrighty, Conrad with the Post.
Yeah, hey there, thanks. I guess this is kind of a two-parter. First, I just heard talk about penalty for not complying. What does happen for employees, whether they're employees of the city or private employees, if they won't or they refuse to get vaccinated? And second, can I get somebody to elaborate just a little bit on the vaccination requirements for teachers and school staff? Does that apply just to DPS or all teachers in the city?
Yeah, Conrad, thank you for the question. I'll start, and then I think Kristen wants to add to this as well. First and foremost, we want to be concerned about the right thing, and the right thing here is compliance. We need folks to get vaccinated. That's where our focus will be. We will work with city employees who are unvaccinated, who express concerns or refusal to be vaccinated. Our goal is to raise their awareness on the importance and the safety of the vaccination. Obviously, there are consequences for not following the order, and this would not be an order if you didn't have the consequences and be willing to follow through with them. And there might be some folks who may lose their jobs behind this. We recognize that, but the reality is that we're going to start with working with every employee who has questions. The goal is compliance. The goal is to get people vaccinated, to create a safe working environment for not only city employees, but for residents and customers who come in, and also for our contractors who are interacting with us as well. So we'll start there, and then you may have some comments on the teachers.
Yep. Thank you, Mayor. I think you answered the question regarding employees, but with respect to schools, the order does apply to all schools within the city and county of Denver, including post-secondary and higher education. So that does include, for example, DPS, but private schools as well.
Seth with Denver Gazette, do you have a question?
Yeah, thank you. If 70% is not where we need to be, what is the threshold that we need to hit? And if we're not able, if this doesn't help depress the numbers, what is the next step for the city and county of Denver? Thank you.
Well, I don't know. I think it would be premature to say that we need to get to 80% or 85% or 90%. I don't know that anybody's going to be able to identify that at this point. What I can tell you is that we know vaccinations are safe and protective, and the more people vaccinated, the less it spreads. We know that. So I don't want to estimate, what is that level that we need to reach, but I will tell you this, we are going to be data-driven. We don't want to implement all kinds of public health orders where it doesn't make sense to do that. We're going to continue to be data-driven. We're going to watch the data, and we're going to start with these high-risk occupations, high-risk settings, see if that gets us where we need to be, evaluate the data, and then move forward, doing what we need to do, if we need to go further or if we're in a good place at that point in time.
Vinny with Bloomberg News.
Thank you. This is Vinny Deljudice at Bloomberg News in Denver. With the danger of winter approaching, what type of risk does the COVID-19 Delta variant pose to little children who aren't vaccinated as we approach again this time of year when we've seen spikes in the disease? Thank you very much.
Well, we all know that respiratory viruses thrive a little bit better in colder seasons. There's a number of reasons for that. Not just the climate itself, but the way our immune systems react. We're all a little bit more weakened during the winter time, especially outdoors and cold and things like that. That's why we tend to get a lot of those viruses during the winter months. So there's a lot of things going on as we move into the fall. Weaker immune systems, the respiratory viruses do better, and then we're all going to get inside. We're all going to move indoors where it's going to spread even more. Right now, the data indicates that severe outcomes with kids is low. However, they can get COVID-19 and they can spread it. Manufacturers are working quickly to get approval to have younger kids get vaccinated. Until that time, we need to make sure that everyone who comes in contact with kids in high-risk settings is vaccinated. That's why we're asking and including teachers and volunteers in school systems, because they can put unvaccinated kids at risk.
Thank you very much.
Is there anyone we've missed?
Chris Vanderbeek with 9 News, can I ask a question?
Go ahead, Chris.
Yeah, I have 2 questions. First of all, in regards to, has any other city utilized this tactic of moving beyond just city employees and moving into the private sector? That's the first question. And I want to make sure that I'm crystal clear on this. All teachers in the city and county of Denver, no matter what system they work for, have to be vaccinated?
Yeah. I missed that last part of your question, Chris. Repeat that last part.
Yeah, sorry, Mayor. I'm just wondering, to be crystal clear on this, every teacher in the city and county of Denver that's operating with students, no matter if they work for DPS or not, has to be vaccinated?
Yeah. Chris?
Yes, so it's all, it applies to all schools in the city and county of Denver, and then it would apply to their employees. So that would be teachers, staff, but also service providers that are on site. So a cleaning crew, for example, that's under contract to clean a school, those employees would also need to be vaccinated. Again, it's about mitigating the risk in that high-risk setting.
And let me answer your first part question, Chris. Very good question. Last week I spent time communicating with mayors all over the country. I think about 12 mayors, about a dozen mayors responded to my inquiry in terms of where they were. I won't name any cities because I don't know where they are in terms of their announcing and formation of their policies, but I think what you're going to find is many cities across the country moving in this very direction. Some have already announced. San Francisco, for example, is already out there. But they're moving to require all of their employees, municipal employees, and then those contractors that work with them. And I think one of the unique elements that, Bob, we added to the order is high-risk venues and high-risk employees are based on their interaction. And so you're going to find a diversity of policy, but most of us are in the same space when it comes to our municipal employees, particularly our first responders.
Thank you, Chris. Is there anyone else that I missed?
All right, guys. Thank you very much. Thank you.